Hello, my name is Noel Moreno and I'll be presenting fecal microbiota transplant. Bacteria play such an important role in our lives that sometimes we do not realize how fortunate we are to have bacteria in us. These microorganisms can keep an individual healthy or not. Fecal microbiota transplant is a process that patients with recurrent C. diff infections are relying on. Barbara Russell, a director of sterilization and infection control in Hospital Miami, says that 80% of the patients that undergo this process find a cure. Russell named her article "The Power of Poop." And it's amazing that she realizes how important fecal matter can be. Today, I'll be informing you what is Clostridium difficile, what exactly is fecal microbiota transplant, and how can we prevent these infections. What is exactly Clostridium difficile, more commonly known as C. diff? According to Miriam Boyle, a medical surgical nurse, the most common healthcare associated infection is C. diff. She explains that this infection is mostly caused by the overuse of antibiotics. She also says that it could start with a mild diarrhea and then have complications of pseudomembranous colitis. Miriam Boyle says that C. diff is identified by two toxins, A and B. These toxins damage the internal lining or the mucosal lining of the gut and then causing diarrhea. And then diarrhea is the first sign of C. diff infection. Now I am going to be explaining what is fecal microbiota transplant. According to Barbara Russell, fecal microbiota transplant is a simple process that it begins with identifying a healthy individual and transplanting the fecal matter into an infected patient with C. diff. She explains that it could be done nasogastric or it can be done with an enema. It could be fresh matter or it could be frozen matter. Sean Mayers, a doctor at Valley Medical Center in Washington, reassures that nasogastric and enema have the same effect, and there are no advantages, no clinically proven advantages of one over the other. She also assures that frozen and fresh matter have the same benefit. There's no advantage of one over the other. Sean Mayer says that prescribers or researchers prescribe suppressive antibiotic to these patients and then they discontinue it 24 to 48 hours after the transplant and then reinsert 50 ml of fecal matter and then they repeat this process if it's not affected. So here I am going to explain you how this transplant is done. So this is our gut, or this is our large intestine that we more commonly know. And so an enema, via enema, they're gonna insert the enema through the anus and then squeeze in like a simple bottle that is squeezed in here, and then the fecal matter will sit here, and then they'll be considered a transplant. But it's just done as simple as that. And then here is where the most important flora of our stomach it's done, it's placed, and then it just grows here, and then it's being preserved by or destroyed by antibiotics. Boyle considers that it's important that we educate nurses and family members how to take care of these patients, especially if they happen to have another infection that they need a type of antibiotic. So it's important that we inform other interdisciplinary team members that this patient has a fecal matter transplant. In my professional experience, I had the opportunity to have a patient who underwent this process, and after a year that she had this process done, it was due because overuse of antibiotics when she had pneumonia, and then she was done this transplant, and over a year after, she still did not have an infection of C. diff again. Lastly, BMC Medicine published an article in 2016 and confirmed the effective process that this is. They describe this as a resolution, no relapse after 1 or 2 administration. It is also, they explain that it's also a risk process and a cost effective when it comes to antibiotics. When it's compared to antibiotics, it's a very simple and low cost effective process to do. This is all my information that I can share, and thank you.